Imagine a world where chemotherapy is not just a one-size-fits-all treatment, but is tailored specifically to each patient's genetic makeup. This is not just a dream. It's becoming a reality for patients battling gastrointestinal, GI cancers, such as colorectal and pancreatic cancer. Recent research from the Perelman School of Medicine at the University of Pennsylvania reveals that genetic testing can significantly enhance the safety of chemotherapy for these patients. But here's where it gets controversial. While the U.S. has been slow to adopt these practices compared to Europe, this study demonstrates that genetic testing is not only feasible, but essential for improving patient outcomes. Every year, nearly 290,000 Americans receive a diagnosis of GI cancers, with colorectal cancer being the third most prevalent cancer in the country. Unfortunately, the current chemotherapy protocols often rely on standard dosing guidelines that overlook the genetic differences among patients, which can lead to severe and sometimes life-threatening side effects. This is where genetic variants come into play, guiding safer chemotherapy practices. The study specifically examined variants in two critical genes, DPYD and UGT1A1. The DPYD gene is responsible for producing an enzyme that assists the liver in metabolizing drugs like fluoropyrimidines, which are frequently used in treating GI cancers. Alarmingly, about 5 to 8% of individuals possess DPYD variants that impair their ability to process these chemotherapy drugs effectively. This can result in toxic levels of the medication in their system, leading to serious side effects such as decreased blood cell production. Painful mouth sores, or hand-foot syndrome. Similarly, the UGT1A1 gene plays a vital role in how the body processes irinotecan, another commonly used chemotherapy drug. Variants in this gene can slow down the drug's metabolism, heightening the risk of severe diarrhea or dangerously low white blood cell counts. By identifying these genetic variants, healthcare providers can adjust chemotherapy doses to minimize harmful side effects while still maintaining the effectiveness of the treatment. In this groundbreaking study, researchers enrolled 517 patients with GI cancers from 3 different cancer care facilities within the University of Pennsylvania health system, all of whom were about to start chemotherapy with either fluoropyrimidine or irinotecan. Among these patients, 288 underwent blood tests to check for the presence of DPYD and UGT1A1 variants. The results were telling. Of the 16 patients who had genetic variants and received personalized dose reductions based on their test results, only 38% experienced severe treatment-related adverse events. In stark contrast, 65% of the 17 patients with genetic variants from a biobank group who received standard doses without prior testing suffered from serious side effects. Furthermore, the group that underwent genetic testing demonstrated a significantly lower need for adjustments in treatment dosage and frequency, 38% compared to 76%, and fewer treatment discontinuations, 31% versus 47%. These findings underscore the potential of precision medicine to not only enhance patient safety, but also improve overall treatment outcomes. This research was made possible through funding from the Penn Center for Precision Medicine and the National Institute of Health's National Center for Advancing Translational Sciences. As we move forward, it raises an important question. Should genetic testing become a standard practice in chemotherapy for all patients? What are your thoughts on this approach? Do you believe that personalized medicine can truly revolutionize cancer treatment? Or do you have reservations? We invite you to share your opinions in the comments below.